Hi, my name is Dr. Luisa Cameli. I'm a clinical psychologist and director of the Emotional Health CBT Clinic in Montreal. I'd like to share some tips with you on how to cope with stress in the context of the COVID-19 epidemic. But before I go on to the tips, I want to say that being stressed is perfectly normal in this context. We have a well-known researcher here in Montreal who studies human stress, looking at physiological response. So, things like production of cortisol, like, what happens physiologically when you're stressed. And she asked the question of what is it about a situation that makes it stressful? And she identified 4 factors. The first one is lack of control. So here we have no vaccine and we also have no treatment. So there is a definite lack of control. The second factor is lack of predictability. We don't know how this is going to turn out. And in this case, we don't know when confinement will end or when the epidemic will end. We don't know how, in terms of our health, finances, how the world is going to be, and so forth. So there definitely is a certain lack of predictability. The third factor that will make a situation stressful is novelty, when it's something that we've never seen before. And this fits the bill quite perfectly. And the last factor is when we perceive a threat to our identity. And in this case, for many people, a lot changed. So people went from employed to unemployed, from a working professional to working at home. The role of parents changed with kids being at home. Also, our role, as a child of older parents, if you have, that changed. So there's a lot that changed, and so we are stressed, and for good reason. But now, what do we do with that? What can we do to make it better for ourselves? And I will share with you 5 tips. So the first one is to take care of the bridges between your physical health and your mental health. What are those bridges? So here we're talking about sleep, breathing, exercise, nutrition, laughing, playing with your pets, like anything, being in nature also, anything that involves your body, but that is also good for mental health. And these days, you also have the added benefit that it does boost the immune system. So for instance, good sleep is very important, as well as, nutrition, exercise. Those are all things that you can do that will help you at many levels. The second tip is reduce your exposure to the news. There's some research that has shown that even in normal times, so when we're not in an epidemic, just watching the news, a lot of exposure to the news can raise cortisol levels, which means stress. So just imagine if that happens in normal times, what it's like now. So I would suggest that you limit your exposure to the news to maybe an hour per day, and preferably not before bed. And another suggestion that I would have is there are websites out there that post positive news, good things that happen. So you might want to look into that. Now, the third tip has to do with thoughts, because a lot of the times when we have an emotion or when we're stressed, there are some thoughts that are not very far. So here you want to specifically ask, what is worrying me now? What am I stressed about specifically? So is it that I will get the virus? Someone that I love will get the virus? Is it about finances in the immediate? How am I going to buy groceries? How am I going to make the rent? Or is it more about what will happen with my work? Will I be able to keep it? So identify specifically what it is that's worrying you, preferably in writing. So then you can ask the next question, the important one, which is, what can I do right now? Is there something that I can control that will make it better? And do it. You can also brainstorm with friends some solution, like someone that you trust, that cares about you. Just, open up about your worries and come up with solutions together. There's, if it's a financial stress, you can look at what's being offered by the government, by your employer, meet with someone, well, not meet, but meet online or speak on the phone with someone at the bank. Work on finding solutions to what is causing you worry. Which brings me, though, to the fourth tip, because sometimes, there's only so much we can control in a situation, and what we want to do in addition is to reframe our worry or our thought. I'll give you a personal example. So when this started and I would see on TV someone who was intubated, it was very scary. I thought, that has to be really painful, and so strange to feel that tube inside of you. And then my reframe has been that, first of all, it's not very likely to happen. But then even if it does happen, they would give me anesthetic, they would give me something to calm me down. I would, by the time you're ready to be intubated, you're already pretty ill, might also have fever. So by that time, I probably would already be in La La Land, and, the experience would not be nearly as awful as I can imagine it when I'm not in the situation. So, little reframe here. The important point, though, that I want to make is that oftentimes you're better off saying, okay, what's the realistic likelihood of this happening? And how would I cope if it did? And deal with it. If you try to push away thoughts, like if you're like, I can't think about this, I don't want to go there, no, anytime you have the thought, you try to push it away, you're fighting against what we call the pink elephant phenomenon, which is very simple. If I were to ask you for the next 2 minutes, if I were to say, your task, the thing that you really need to do in the next 2 minutes, whatever you do, don't think of a pink elephant. And I start the stopwatch, well, guess what's going to happen? You're going to think and see a pink elephant for the next 2 minutes. So pushing away thoughts, generally speaking, doesn't work as well as dealing with it. Which brings me to the next example of a reframe, which has to do with death. With hearing, the number of deaths, the death toll every day, sometimes even multiple times a day, it's really easy to get into the mindset that having COVID-19 equals death sentence. And in some cases that can be, but in most cases that is not so. So the issue here is that the people that have the mild symptoms, that in some cases don't even know they had it, or the people who struggle, it's really, really hard, but they stay home, and they, after all this difficult experience, they make it through. At home, they're not going to get on the news. So those are not the people that we're getting exposure to. And so it's easy to get into the mindset of, what we see is what's more likely. versus the actual facts. And my final tip, number 5, I would say connect with yourself and with others. It's, as sad a period as it is because of the loss of lives, people who lost their lives and the loved ones of those people, it also is bringing up the question of, both as a society and as individuals, what's really important to us? What really matters? What are our values? And this is a really good question to ask, because sometimes with daily life, we just get further and further away from what matters or from ourselves. An exercise that I often use with clients is to have them write on the one column like what's really important to them, and then in the other how they spend their time in the last week. And ideally you want those to match. But sometimes, again, it's easy to get into the routine and forget about those things. And you want to connect with loved ones. You want to connect with family, with friends, with colleagues. If you think about it, this is such an unusual experience that we're having. But it's one that is shared. We're all in it, and we're all feeling very vulnerable in it. And those really are the conditions for closeness, for coming together. So we might not be close physically as we're distancing, but that doesn't stop us from being close emotionally. So that's it. Those are the 5 tips and the why we are stressed now. So I hope that you have found some of the content of value, and hope to see you again, as we will be posting more material from us at the Emotional Health CBT Clinic in Montreal. Thank you.